Collaboration through innovation. Collaboration through innovation. The challenge or problem presented and faced by many organizations is creating a medium for accurate information sharing. The issue of misinterpretation of information presents as a barrier to providing comprehensive care to anyone involved. Those affected are administrators, care providers, managerial staff, and of course, the patients themselves. From a traditional standpoint with regard to approach to care, the focus on communication sharing was primarily determined between like disciplines with specific levels such as the communication sequence between nurses and doctors. Also, information on available tools effective for interdisciplinary communication were extraordinarily difficult to find. This limited efficacy of treatment as well as positive patient outcomes decreased. The collaborators I chose to represent different aspects of my innovation project consisted of psychiatric assistants, who would represent support staff, nurse practitioners, representing primary care providers, a certified public accountant who represented the patient aspect as well as business interests, and an administrative director representing managerial personnel. All of these individuals had significant input that was beneficial to implementation of my project. Significant collaborator input statements came from all involved. From the psychiatric assistant, it was stated, "I'm not very tech savvy, and I know that a lot of the patients aren't as well. I also think people are worried about the cost of this type of technology." From the nurse practitioner, it was expressed, "I'm all for better communication and going the extra mile for patient information. It has to be simple to use if you're going to input new technology and relatively inexpensive." From the certified public accountant, he said, "I know we have the technology and we should use it. I think that would help decrease costs with less patient hospitalizations." The administrative director said, "If it helps to decrease cost of care, let's use it. We could present this technology to start at staff weekly meetings." All of these different collaborators' input was very important. They did have kind of a common theme. They represented what patients might be thinking as well as staff in different levels and different professions. Implementing the thoughts of the collaborators within the input of the results of my innovation helped to focus my project on sharing information on the technology with staff and patients to ease some of the anxiety about this new application in care. It was also directed to ensure inclusion of a varied staff and patient population. The research perspective looked at cost and determining the ease of use. Interacting with all the collaborators and sharing information using this application was the task that we had at hand. Varied staff members, disciplines, and levels of care working in concert, sharing information across disciplines and position is ultimately beneficial for all involved. This promotes genuine unity as well as increased morale and collegial support. The Psychiatry Pocket mobile application appears to fit the mold of mobile technology and innovation at its best. It's simple to use and the principles are easily applied. The language is straightforward and presented in a direct format. It's easily understood with regard to terminology, and the application itself is versatile and extremely descriptive in its research-based information. There are numerous assessment tools used for measurement as well as referenced throughout this application. Sections of the application are categorized by diagnosis with specific criteria identified in basic terms. Here you see the representation of the Psychiatry Pocket icon. Next we have the table of contents, which consists of essentials, disorders, tools, and a friendly user guide. Next, the table of contents is continued and is descriptive in its entirety. The search engine is utilized for whatever topic that you are looking to address or identify. Disease description is easy to understand and descriptive in criteria. At last, we have the summary of solving this challenge. Innovation is defined as a new method, a new idea, or a new device by Merriam and Webster. This project incorporates new technology. The idea is a new approach to sharing and implementation of information by providing a medium for common dialogue to be shared with those of varying levels of education, profession, and status. This application can turn most any computer-based devices, such as desktop computers, laptop computers, iPads, or smartphones, into usable tools in the provision of care. Applications provide increased opportunity for intersectional collaboration with ease of access to researched information. Mobile applications are the new, now, and the future of care practices and can be used on a variety of devices and within many different situations. Chosen health information systems in concert with these applications and devices can be utilized to provide a myriad of diagnostic functions.